Welcome to Real Health Chat, our stories of health, justice, and change. I'm Julie Hard, Director for Global and Community Partnership in York's Faculty of Health, and this is where we sit down for authentic conversations with the researchers, educators, students, and community partners who are building healthier worlds right here at York University and beyond. No lectures, no jargon, just real people sharing the work that's creating upstream change in our communities. Let's chat.
In today's episode, I'm joined by Giovanna Batti.
Thank you for having me.
Oh, thank you for being here. You are a recent graduate of York's Global Health Program with a specialization in global health policy, management, and systems. First of all, congratulations on your graduation. Yeah, big achievements in there. And you completed a practicum with this national organization, Results Canada, and you contributed to their efforts and to address global challenge of tuberculosis.
Right.
And specifically, you dealt with advocacy.
Right.
Is that correct? Yeah.
Yes, that's correct.
So, first of all, I guess my first question would be, tell us about Results Canada. How was the practicum?
It was great. So I did my practicum from Toronto, so I did it online. And Results is basically a non-for-profit organization that mobilizes everyday people to generate the political will to end extreme poverty. And I know that's a mouthful, but essentially it's a volunteer-based organization. And the whole point is to have volunteers sort of act as lobbyists so that we could essentially raise up our campaigns. And we do this through a number of methods. We write letters to members of parliament in the Canadian government. We write LTEs, which are called letters to the editors, op-eds, and we use social media as a powerful tool for advocacy.
Okay. So I guess my first question would be just, can you walk us through what this day-to-day was at Results Canada?
Yeah.
Like the kind of maybe the projects that you worked on?
Yeah. I particularly, more specifically, I worked on tuberculosis projects. And if anybody who doesn't know what TB is the world's deadliest infectious disease. And it's afflicted 1.25 million people in 2023. So 1.25 million people died of TB in 2023, and 10.8 million people were contracted tuberculosis.
Okay.
Yeah, so it's so day-to-day life was essentially me learning about tuberculosis in the onset of my practicum, right? Learning about it and then how I could apply that to our work in advocacy. So more specifically, our campaigns and my letter writing to my own MP, because in Canada, we have what we call our electoral districts, and each MP is assigned to those electoral districts. So as a Results Canada intern and technically a volunteer, that was my job, was letter writing and making sure I sort of built a relationship with my MP.
Was it both MP and your provincial MP, or
just my MP?
Oh,
yeah, just my MP. And it was definitely at a pivotal point in time because we were having a federal election, so that was really important to start building that relationship and talking to your MPs about our campaign and our previous campaigns. So yeah, I really enjoyed doing that.
So I also have here that TB also affects more people than malaria and AIDS combined.
Yes.
That's pretty drastic there.
Yeah.
So what specifically about Results Canada drew you to pick your practicum there?
I think the emphasis on equity and community, and then tying that into advocacy. So what I liked about it was I could really connect with like-minded individuals who also were doing the same things that I was doing: letter writing, using social media, writing letters to the editors. And for those of you who don't know what that is, it's just like a short writing sample on a topic of interest to you, to the writer. And then you would send that into a number of newspaper outlets. So, for example, it could be the Toronto Star, the Globe and Mail, right? And then an op-ed is like a longer version of that. And so I was very fortunate to meet people who were writing these op-eds, these letters to the editors at Results, who I could just connect with, and they were very helpful in helping me write my own letters.
Oh, okay. Yeah, that's actually really cool. So I actually have here that in one of your writings about TB that you said it's not a political priority, despite having treatments available. So when you're researching and writing about this issue during your practicum, what surprised maybe you or even just people the most about TB today?
I think that it afflicts 1.25 million people.
Yeah?
Yeah. Like 1.25 million people died of TB in 2023. Because if it was on global health agendas and if it was a priority, we could effectively eradicate the disease. But that's not the case.
And this disease has been pretty long-standing.
Yeah, it's been around for, millions of years. Like it's affected many people throughout history.
Right.
And actually, during my practicum, I got an advanced copy of, and I'm not sure if you know who this author is, John Green. Do you know who John Green is?
I feel like I recognize the name.
Yes, he's familiar for writing young adult novels. Okay. So like The Fault in Our Stars.
Okay, yes. That's it.
So you've probably seen his movies.
Yes.
And a couple years ago, he went to Sierra Leone and he met this young TB patient in a hospital there. His name was Henry. And he decided to write a book about TB from that experience. And so during my practicum, I got an advanced copy of that book. And that book is called Everything is Tuberculosis. And that was probably I love reading. So I was very happy to get that book and to read it. And I also love John Green. So.
No, that's actually really interesting. So is this John Green's only book about tuberculosis?
Yes, it's his only book about TB, but he's become a pretty well-known TB advocate since then. So it's really nice to see that people within like the publishing space or writers are also paying mind to tuberculosis.
Yeah, honestly, that's actually really good to know.
Yeah.
I also have another thing here, the Global Fund to fight AIDS, tuberculosis, and malaria lost their 8th case during your time there, during your practicum.
Right.
How does this connect to what's happening in people's daily lives, especially here in Canada, if you have any insight on that?
I think actually there was one instance where I was in a national call and national call as in we were with a lot of volunteers on the call, the Results Canada team, to talk about our campaign around the Global Fund or other campaigns where we're asking for international assistance, right, for these diseases.
Right.
For these funding mechanisms.
Okay.
Because it is a multilateral funding mechanism. And one person asked, well, a lot of people in Canada, especially in terms of like the economic situation here, the cost of living, how is it that we talk about these issues in terms of international assistance? But then also there's this particular issue here in Canada that many people are facing. So it's very difficult to frame the issue. I think that was one thing that was hard, especially for me, is like how do I frame the issue when there's this happening in Canada and we're asking for this in terms of international assistance. So it's really the way you frame the issue, especially as a volunteer who might be new to Results Canada, right? But the staff is there to help you, right? And the volunteers are there to help you. So I think to answer your question, it's really about how we frame the issue. And that was one thing that I struggled with in the beginning, but slowly I began to get better at that. Yeah.
So, and it makes sense because practicums obviously come with their challenges.
Yeah.
And so would you say that was like the main challenge, or what were some of the other challenges you might have faced?
Sometimes it was a little bit difficult to get engagement from my own MP. But after the election, it wasn't as difficult because I think typically like they go into these new roles and they want to go into the community, whoever your MP is, and they want to meet their constituents. And it is their job to hear you out. Like if you have an issue that you want them to know about and that you would like to be represented in the House of Commons, I think that's really important.
Yeah, that true.
Yeah.
Very true.
True. Do you know your MP?
I do know my MP.
Really?
Yeah.
Okay.
My MP is actually a kind of one of these popular guys right now.
Really?
Yeah.
Okay.
Very, very intense. In a Y-File story I have here that you shared with the York community, you wrote about Canada being at a crossroads, and it has the opportunity to emerge as a global leader.
Right.
specifically with potential cuts to foreign aid from other countries.
Right.
So I know you kind of just went down a little debrief about working nationally and with your MP, but what do you think the most important thing you learned about Canada's role in global health is?
I just want to say, like, for example, one of the major news stories that was happening during my practicum was the dismantlement of the United States Agency for International Development, so USAID.
Okay.
And so they were one of the largest bilateral funders for tuberculosis research. And that's detrimental, right? So if someone is abroad and they're getting TB treatment and then that just stops, what do you think would happen next? Right? We can't effectively treat tuberculosis, right? And something to know about tuberculosis is that it typically treatment can last, up to like months. It can last up to months, right? So people who are on TB medicines should be sticking to those medicines for however long their healthcare practitioner says that they should be on them. So if we stop it, then what happens, right? So I think that was something that I also, like I said before, I highlighted in a lot of my letters. In my writing.
In your writings, yes.
In my assignments.
I guess I have a next question here is, looking back, what was the most rewarding part of this experience?
The most rewarding part?
Or something that really stuck with you?
What stuck with me is that engaging in the issues we care about is not a question of possibility. It's about, I think, determination and will. And I think it's a pretty general statement, but it's true, right? And progress, and I've said this before in a lot of my presentations and the work that I've done with results, is that it's the result of open-ended, ongoing, sustained collaboration. We can't do it alone. It's not something that we should do alone, especially in advocacy, because, you can get a little, like, sort of, how do I explain this, like, in a way that makes sense, but it can be a little difficult when there's not a lot of engagement with the people you're trying to engage with. Right. So that's why you have to just keep going, keep that growth mindset. And that's just the way to go. As with anything in life. Because life will bog you down. Like, it will take you down to places that can be really difficult. But if you keep that growth mindset, you can go very far.
Yeah. So I kind of am going to go back just a little bit.
Mm-hmm.
Talk more about your op-eds.
My op-eds.
Yeah. So what can you tell us about that? Because working with an MP, that's a pretty big role in our government.
Yeah.
And op-eds, very good form of journalism right there. So what can you tell us about your op-eds?
My op-ed, the one that I wrote for, more specifically, York, was very personal in a way, because I actually, for one of my op-eds, I visited a museum in Toronto.
Oh, which one?
The Spadina Museum.
Okay.
So, and I'll tell you the story of why I did that. In my research about tuberculosis, I had learned that one of the family members that lived in that particular historical house had contracted tuberculosis at one point in time. And so I wrote the beginning of my op-ed on that person and the family. And it was really interesting to actually go to the museum, talk to the museum curator, and listen and learn about the story. And in turn, I also provided the museum curator with some resources on TB that they could put out for their displays. So when people come into the museum, they can see it for a specific time period that they want to highlight. And it was interesting.
Yeah, no, that's really cool. So is that something that even you'd be looking more to do, like go to these areas that have experience?
I love history. I love history. So I was just like, I might as well, like, this seems fun. And it was close to where I lived. So I was like, I'll just walk. And
I'll just walk and, advocate.
Yeah, advocate. Well, advocate. It was this house has been around since like the 1800s. So it's a very old house. So I enjoyed doing that.
I mean, you've mentioned a lot about your experiences and how this kind of affected, the practicum kind of affected how you even operate outside and the growth mindset and everything. But is there anything specific that changed your personality as a result for working in TB advocacy?
Yeah, I will say I was very timid before.
Yeah.
I was timid. I was shy to speak up in the beginning stages. But then at the end, because I was doing a lot of talking, a lot of writing, and a lot of just really trying to understand myself in this space, because there's no one box. Like, it's not a one size fits all in advocacy. Like I said, I was timid, and then by the end of it, I did my practicum presentation. And I told you this before, I didn't even use a script. So I was quite proud of myself to be able to do that.
And that's what you could take.
It takes sorry, yeah.
Especially in global health, that's...
Yeah, and the thing is, it's about being able to talk to people as well. Just having a simple conversation with people can take you way, like, far beyond that. And, your studies are important. What you're doing in university is important. So making the best of all the opportunities that come your way is just stay on that, especially, like I said, as a student who's trying to find their way within university life.
So I guess just to get like a good summary of everything, I just want to kind of ask this, not my final question,
okay,
but would you say that your practicum at Results Canada really did benefits your education here at York?
Yeah, I think more specifically, the personal development as well.
Yeah.
Like I was touching on before, because one thing that you gain is not just the professional skills, like I said, but then also the personal skills, right? So soft and hard skills that are really important that can be transferable in any part of life. Do you want like specific examples?
If you have any, sure.
I think one thing that I really enjoyed was being able to work within a team.
Yeah.
And that's really important. So that collaboration part. I worked with different, I worked with like the communications team at Results Canada. I worked with my supervisor, Leigh Wraithby. Wonderful. She's a wonderful
shout out
to Leigh Wraithby. And I also just worked with the fellow volunteers. I actually met 2 tuberculosis patient advocates and survivors, and I had really great conversations with them.
Nice.
But if I hadn't learned a lot about tuberculosis and put in the time and the work, I probably wouldn't have been able to converse as well as I would hope. So it's really just about learning where you are, who you're going to speak to, and why you're there.
I like that.
Yeah.
I like that. I remember those 3 little points.
Those 3.
No, that's actually really informative, really insightful.
Yeah.
I'm glad that you came on here to talk about that. Thank you very much.
Thank you.
I do have some rapid fire questions I would like to ask you. All right, number 1, name one healthy activity you think everyone should engage in.
One healthy activity. Spin class. Try at least one class in your life.
That's like cycling, yeah.
Yeah, it's cycling. I did it this morning.
Oh, really? Name one health trend that you would never subscribe to.
I don't know. Do you have an example of one that you wouldn't?
I wouldn't water fast.
I don't know. Fasting for me, I can't keep a schedule for fasting.
Yeah, I can't do that. Specifically water fast? Yeah.
I can't keep a schedule.
Yeah. Is there a TB myth that comes to mind that you had to correct during your advocacy work?
That it only affects the lungs. That was also it's only like your respiratory system, but there are many other symptoms that could occur.
Really?
Yeah, that in terms of tuberculosis, they vary, and I won't name them here because they're too long to list. But yeah, it's not just like your respiratory system; it can affect a lot of other parts of the body as well.
Okay,
yeah.
No, that's really interesting because I feel like that's a really common myth.
A TB patient advocate and survivor told me that because I got to interview him, and he was like, I said, what are the common myths? And he was just like, and he told me some of the common myths and some of the symptoms that he had experienced.
Okay, well, that's good to know now. What's one health myth that you believed for way too long?
A health myth that I believed for way too long? I don't think I believe health myths. I'm Italian, so we don't really. The only health myth that we believe is that Vicks, Vicks, the rub, will cure
everything. Yes.
Like that's the only thing that we think is we still believe it.
I still believe it.
Okay.
No, that's a good one. That's a good one.
Yeah.
Okay, true or false? Tim Hortons coffee counts as a health intervention.
gonna say true.
Sure. Okay.
Well, I don't know. Ice caps, I would steer clear of like an ice cap.
Those do something.
I would steer clear of an ice cap.
Okay, and I guess I have my last question here. If you could get one celebrity to become a TB awareness ambassador, who would it be?
One celebrity.
Yes, maybe if a band, but one
band?
One band, one celebrity. You know, if they're like a collective, then sure, but let's try to...
I think Gracie Abrams. I just went to her concert.
Yeah.
I just went to her concert at Budweiser.
And
I feel like she would do it. Yeah, she would do it.
Oh, for sure.
Yeah.
Okay, well, before I end, is there anything that you would like to, I guess, mention, any last minute comments about TB awareness or anything I kind of missed out on?
I think we touched on everything today, and I'm really glad that I got to come and sit here with you because it's an important issue, and I just hope that there are more advocates in the global health program who would love to like step up and maybe even also do their practicum at results as well. Yeah.
Oh, thank you, Giovanna, for sharing your work and your experience today. How can people learn more about this work? I guess if you have anything personal, if you do personal advocacy, is there anything people could reach you at?
Anywhere they can reach me at?
Yeah, or even Results Canada, maybe.
Yeah, I mean, you can reach me at my Instagram. My Instagram is just my name, Giovanna Batti, all lowercase.
Cool. There you have it. And is there anything that people could see for any Results Canada work?
Yeah, so we're actually doing our campaign right now is on the Global Fund, and anybody can join. So it's a very open community, and we welcome anybody who wants to, be a part of our advocacy efforts.
And is this specifically like Toronto, Ottawa?
Yeah, I mean, we have different volunteer groups.
Okay.
So we have one in Ottawa, we have one in Toronto, and we have because it's the GTA, we have a couple we have one in Brampton and yeah.
Okay. Well, thank you. Thank you very much for being here. Thank you very much for listening to me fill in for Julie.
Thank you.
Real Health Chats are produced right here from York University's Faculty of Health in the Real Health Studio. For everyone listening, if today's conversation resonated with you, we'd love to hear about it. And if you're working on something that's building healthier communities, we'd love to hear about that too. Send us an email at eehealth@yorku.ca. Until next time, this has been Julie Hard, and we'll chat soon.